these experts have been putting before them for months and months and months about what we could do on an urgent basis to end the deaths today, tomorrow, and the next day as we are fighting through the second wave. Alors, en français, c'est une crise humanitaire et je n'utilise pas ces mots légèrement, mais je l'utilise dans le sens classique. Ça, c'est une grande menace à la santé et la sécurité de nos résidents dans nos centres d'hébergement et de soins de longue durée. Et pour les personnes qui insistent que c'était quelque chose inévitable, je dis non. Je dis que le Canada est le pire parmi les pays riches au monde dont le taux de mort dans nos centres de soins de longue durée. Je dis que absolument c'est évitable. Nos experts disent que c'est évitable. Et si on voit maintenant que presque trois quarts de nos morts sont dans nos centres de soins de longue durée, c'est parce qu'il y a encore une inaction parmi notre classe politique. Nous avons eu une réunion de nos premiers ministres hier pour discuter plusieurs thèmes sur la pandémie. Et oui, ils ont discuté les centres de soins de longue durée et les morts, mais non, ils n'ont pas pris d'action. Non, ils n'ont pas sorti avec une acceptation des recommandations de nos experts. Alors, les morts continuent, les milliers de morts continuent, et nous sommes ici encore pour sonner l'alarme. I'm going to first pass to Mary Oko, but before I do that, let me please first just say thank you to Dr. Doris Grinspan, who is the Chief Executive Officer of the Registered Nurses Association of Ontario, to Laura Tamblin-Watts, who is the Chief Executive Officer of CanAge, and to Dr. Vivian Stamatopoulos, who is a professor at Ontario Tech University and also one of our leading experts on long-term care and has been sounding the alarm. But first, I want to call on Mary Oka. Mary has a mother who is in long-term care, and we were just discussing some of the good news around her story, but really it's important to understand what is going on and see the face of this crisis. And Mary, thank you so much. As someone who lost her father in long-term care at the end of May, in the center, which is now has the biggest outbreak of COVID cases in all of Ontario. That is St. George's. I am very grateful for you having the courage to share your story with us on behalf of all of the people who are so worried about their loved ones in long-term care. Mary?
Thank you, Annamie, and thank you everyone for attending this this discussion and for the media who's on the call. So just to give you a little bit of background, as Annamie said, my mom lives at Copernicus Lodge, which is a long-term care home in Toronto. And we have about 228 residents. I'm also the chair of the Family Council, representing all of the families of those who have loved ones living in long-term care. So for most of 2020, our home was actually one of the few fortunate homes that did not have a COVID outbreak. So we managed to pull through the first wave unscathed, and you know, our staff are remarkable. I give them 100% credit. They're very committed. They're very dedicated souls and angels, as we like to call them. But unfortunately, our home was touched. We had our first case of COVID infection that was identified on December 16th, probably brought in through community transmission. And we've been struggling. And why have we been struggling? Like yesterday, the stats were, we have 63, these are infected. So 63 residents who have been infected, 37 staff, and 10 residents. We also have an independent living apartment block. So there's about 200 plus families in there. So 10 have been infected in that area. Some have been recovering. So in terms of active cases, we still have 77. And we have, unfortunately, 8 of our residents have died. And what I wanted to touch upon with Annamie's comments was, you know, these are not stats. These are moms, dads. These are individuals who, you know, touched and were part of our community. And one person, especially on my mom's floor, the gentleman who passed away was in his 70s. He was a very, you know, welcoming, very open individual. His neighbors or residents, as you would like to call him, loved him. The staff loved him. We all loved his contribution and being part of our community. And this was a significant loss for all of us. So fortunately, my mom is still okay. She's tested negative, and some of the happy news is that today at Copernicus, they're going to start vaccinating the residents and some more of our staff. So I welcome the vaccination, but unfortunately, it's still a timing game because it's the first dose, then we have to wait another 21 days until they're fully inoculated. So time is of the essence, and we just need, like, in terms of, if I can say my 3 points, is that we need to ensure that families are never locked out, because we were locked out initially. We're only starting to slowly be reintroduced back into the home, given that the staff need our help in terms of assisting them because of the staffing shortages. Second, we need more staffing, but I'm sure that Dr. Doris and Dr. Vivian and Laura will be talking about that. And then third, that families and residents need to be at the table, because all of these decisions are being made without the voice of the residents and the families. And so we understand that it's a pandemic, we understand that it's COVID, but we need to be at the table being able to provide our contributions and our input. So that's it.
Thank you. Thank you so much. And so much of that echoes with me as well. I absolutely know that one of the things that led to the death of my father, who did not die of COVID, but our experts will tell you many thousands more died of due to the understaffing and things that went unnoticed and preventable infections and so forth, that we would have caught it. His family, had we had access to that facility, we would have noticed him getting sick and deteriorating before it became sepsis and before he died avoidably. I want to pass it now to Dr. Grinspan, who again is the CEO of the Registered Nurses Association. Dr. Grinspan.
Thank you very much. And first, I want to thank you, Annamie, for again sounding the alarm bell, and Mary, for the contributions you did to RNAO in developing the guidelines that finally were accepted in this province. So one kudos on one thing to this province is that the Ford government, and let me say this, it was Premier Ford and his staff directly involved in ensuring the issue of essential caregivers. But that's where my kudos stop. And we are very well known to give kudos where kudos are deserved, because they are, not every province is doing this, and also sounding the alarm bell, which I need to sound even more now after the Premier did not announce in Ontario new measures at 10 a.m. I was very much hopeful he will. We did ask yesterday for 4 measures. We did ask to a full lockdown with a curfew to reduce community spread. We did ask to not reopen the school, so we got check mark on that yesterday. We did ask for more support to vulnerable populations. You cannot ask Annamie, you will know this also. You cannot ask essential care workers that are living in multi-house, multi-generational communities to just be careful. You need to provide the how to be careful. And if they need to isolate, how to do that. We don't have it. And we did not move with 24/7. And that's what we have been asking from the outset, 24/7 vaccination in Mexico. It is unfathomable to anybody listening today that the vaccines went yet again, first to the hospitals. Exactly same as the PPE went first to the hospitals. We sounded the alarm bell before anybody else. In fact, my biggest fights with Dr. Williams were about PPE needs to go first to nursing homes. It didn't happen. So what are we asking now? In addition, you will continue to hear us 4,200 cases, more than 4,200 in Ontario today. We will reach 5,000 in Ontario, no doubt. So the 4 measures we're asking, we will continue to ask. And sadly enough, UHN just announced that they are done with, they don't have enough more vaccines. So here you go, first hospitals and then whatever is left for nursing. It ought to have been the opposite. It was. I had yesterday at 2 a.m., I was till 4 a.m. working, at 2 a.m., a nurse practitioner in a nursing home saying to me, Doris, I don't need more stuff to give the vaccine. Just send me the damn vaccines. I don't have the vaccines. Some of the homes have the staffing to give the vaccines. They don't have the vaccines because why? Just look at the pictures who got the vaccines first in the hospital. National standards is something that we wrote to the Prime Minister when we basically gave up in our fight or our plea or our begging the Premier's office to move with what we call basic care guarantee, which basically speaks about 4 hours, worked hours of PSW and nursing care at the bedside with the nursing homes, with every resident, every day, every time. And it has a very specific formula. The Prime Minister, to his credit, took on that call for national standards. But as you said, Annamie, that's where it stopped, right? Because the usual bickering between the Prime Minister that doesn't want to force his way and the premiers that want money without strings attached will be forever this way. So we're asking now national standards. We're asking the basic care guarantee in Ontario legislated, because all we're getting now from the Ford government in the announcement of the staffing is 15 minutes before elections. The rest is all by 24, 25, and it will not happen. And I will tell you why it will not happen. You will have the people with cancer asking for more care. You will have the people, rightfully so, rightfully so. So this is our last kick at the can on doing justice to those people that already paid with their life for the go forward. And this is a humanitarian crisis or a genocide, whichever way you want to call it, as we speak, for people in nursing homes. Every day we wait with more staffing. The Premier just said they're putting security in the homes, so the workers will test themselves twice a week. It's not security we need, Premier. What we need is staff so they can do the work that seniors need and deserve. And what we need is provincial basic care guarantee, enough of saying I cannot sleep at night. And what we need is national standards with the Prime Minister that will say, I am pushing forward with that, whether the premiers want or don't want. Here is the money. Those that want to join in solving this issue now and for the future get the money, and the others go home, you don't get the money. Simple as.
Thank you so much for that, Dr. Grinspan. And I am going to continue to try to put a human face on this, Mary and I and all of us. I'm going to say again that, this is why it's important to have different people in politics. And in my case, I grew up very modestly. We slept, 3 of us on a pull-out bed and my brother on another one in a very 1-bedroom apartment with, usually there were 6 of us in there. And my grandmother was a personal support worker in long-term care. And if she had been working now, the idea of telling her isolate,
it's absurd.
It doesn't mean anything. And so I will just leave that there. But these are real people with real challenges. These are people that are being left to deal with something on their own that they should never have had to. We're going to come back, but I'm going to pass now to Laura. Laura is again the CEO. Laura Tamblin Watts is again the CEO of CanAge. Laura, over to you, please.
Thank you so much, and bonjour à tous. Merci beaucoup pour le chef Annamie Paul d'avoir convoqué aujourd'hui cette importante conversation de les soins de longue durée. Thank you so much for all attending this morning. I want to thank Mary so much for sharing her story and for the thousands of other Marys that we're not hearing from today. Today, Ontario posted an all-time high record, and our organization is pan-Canadian. So one of the pieces that we can share the light on is a little bit about what's happening in other jurisdictions, not just what's happening in Ontario. And what we are seeing in Ontario is not a lack of understanding about what needs to be done. We are simply seeing a lack of prioritization about what needs to be done. And I want to pull on what Doris pointed out, which is that Ontario has consistently prioritized acute care to the detriment, and let's be clear, the death of thousands of seniors. And this has not happened in other jurisdictions. And we can see with ease the difference in mortality and morbidity rates, for instance, in Nova Scotia or New Brunswick or British Columbia. So the failures to take action on the Ontario government is measurably different in the lives of our loved ones. So what do we need to do right now? Because we are in a humanitarian crisis, in crise humanitaire, which is completely avoidable at its scale. I'm not saying every aspect is avoidable. I am saying that the scale is avoidable, and we can see specifically other provinces who have avoided it. So we at CanAge have been calling for immediate installation of rapid testing for everybody who works, visits, and lives in long-term care, and immediate 24/7 prioritization of vaccinations, as well for everybody who lives, visits regularly, and works in long-term care. This is not magic. This is not even novel, but what it is not yet accomplished. And if we look at other jurisdictions around the world in terms of uptakes of vaccines, they have done this, and the humanitarian crisis is being reduced. Thanks very much.
Thank you very much. And then finally, Dr. Vivian.
Thank you. I want to shed a little bit about what is happening right now in Toronto. I woke up to a very sad and infuriating investigative journalist piece by Karen Howlett. And unfortunately, Annamie has experience with this particular home, St. George in Toronto. So this home right now has the highest case count of any home in Ontario in the second wave. Over 150 residents are sick. The outbreak started December 4th, and help was only sent in a month later after it was too late. And I want to point something that just got leaked today. A paramedic report was just leaked of paramedics that were called in for distress calls. And they found, quote unquote, a patient naked, alone, ashen face, and struggling to breathe. And worse yet, they found that there were no measures in this home that were minimal to non-existent to actually protect these residents from contracting COVID-19. The staff were apparently complacent about safety precautions. And no staff even bothered to come see the paramedics when they were in the home trying to help this one individual. God knows how many others were like this. I mean, this is a scene straight out of literally the opening scene of The Walking Dead. And this is happening right now with no lessons learned from the first wave, no accountability from our Premier and our Minister of Long-Term Care. And I would like to know from them in particular if they were informed about this paramedic report, because I would imagine that they would have been. And no talk about accountability, no talk about added measures to protect these residents. And we are seeing time and time again, these poor residents are being left to neglect, abuse, and quite frankly, at this point, this is institutionalized violence.
Thank you very much. And it is, these words from all of the people who are here today, I'm hoping that they break through because it is still not too late, as we've said, to prevent the next death and the next one. We are still in the grips of this second wave. There is still the time to save lives. And I'm going to just conclude with the recommendations that came out of our 2 town halls earlier this week. En fait, il y avait un énorme consensus parmi les experts. On a eu une table ronde en français, une autre en anglais. On a parlé avec 11 différents experts et il y a un consensus absolu. So the things that our experts with one voice have been calling for on an urgent basis to prevent the deaths, things that are clear, available, and implementable today. And you've heard some of those things today. Accelerating the speed of vaccinations in long-term care facilities, increasing rapid testing, increasing and stabilizing staffing in long-term care homes, and improving training and pay for workers, setting a national standard of 4 hours of regulated care per day for each long-term care resident, greater separation of residents within long-term care to prevent the spread of infection, ensuring safe family access to long-term care facilities, and more stringent accountability and penalties for long-term care operators. Alors, accélérer la vitesse de vaccination dans les établissements de STL, augmenter le nombre de tests dans les établissements, augmenter et stabiliser les effectifs de foyers de STL et améliorer la formation et la rémunération des travailleurs et travailleuses, fixer une norme nationale de 4 heures de soins réglementés par jour de soins pour chaque résident de SLD, séparation accrue des résidents dans les établissements de SLD pour prévenir la propagation de l'infection, garantir un accès sûr des familles aux établissements de SLD et responsabiliser et sanctionner plus sévèrement les propriétaires d'établissements de SLD. Every time we do one of these, we hope that it will be the last. Every time we do this, we hope that this will be the thing that unleashes the action that we need. We will continue to speak out. We will continue to hold these sessions. We will continue to hold our political actors accountable. And I can say for my part, I am ready to work with any political actor who is willing to come together with us to deal with this on an urgent basis. Thank you very much to all of our speakers. I think we are going to end the Facebook Live and then take questions from our media. Thank you so very much. And thank you for everyone who joined us once again to speak about this humanitarian crisis.
Hi, this is Rosie Emery. For the media, would somebody like to ask a question? We'll have one question, one follow-up, please. C'est Rosie Emery, attachée de presse pour le Parti vert du Canada. Alors, pour le média, s'il y a une question, puis une question de suivi, s'il vous plaît, signalez ça. No questions? Pas de questions. Okay.
Okay, thank you so much to all of you. And again, it's I see we have Global, we have CPAC, CTV, and a number of outlets. We're just going to keep doing this. And as you said, I don't remember which one of you said it, but yes, in the names of all those who have already died, and in my case, in the name of my father, we're going to keep doing this. Thank you so much. We're going to end now. Enjoy the weekend as much as you can. And Dr. Grinspan, we will all have sleep someday soon.
I hope so. So
I
far,
hope so.
and I want to comment, given that there is a few seconds, someone was sending me a direct message. I want to just put my email. I apparently misspelled it at reneo.ci. I was trying to listen versus doing this. You know what Vivian said? Read the piece in the Globe and Mail. That's exactly what I said. Vivian, you may be surprised. The minister may not have known, actually, what was going in that home. Many of us become aware through the media to what's going on in the homes. And I want to
I
say
wouldn't
to
normally
your,
say that,
to your,
Doris.
I want to say to the point that you made on your mother, Annamie, it's not the fault of PSWs or nurses. I mean, the premier can put 20,000 security people if he wants. They're doing the best they can. Yes, obviously, always there is a bad apple anywhere, also amongst lawyers and amongst politicians. Let's be clear. But overall, it's not the fault of the healthcare workers because they're not enough. How can you provide decent care if there are not even enough? And then to make it worse, they had left the families out first.
Yes.
Exactly.
So the only grace in Toronto is that families are in now, but they have not added a single minute of staffing.
Yeah.
Despite this tragedy, not a second of nothing. And then the vaccines were given first to hospitals. It's unfathomable. It's a genocide. This is not a humanitarian crisis. It's a genocide. That's what.
And we have to call it by its name, and maybe that will be the
That is what it is, because look at the definition of what genocide is.
Yes, it is. These are textbook, just to emphasize, these are textbook definitions we're using. There is no exaggeration. There is no hyperbole. These are textbooks. So
it's a tragedy. It's a tragedy that I have never seen something like this.
No, no, we have not. This is something that people do not associate with Canada.
And that's why that's why you have a huge role, because I do believe that the Prime Minister is real, that he wants to know national standards, but we cannot wait for elections either. He needs to push through now and put a pot of money, and maybe you can do a private bill. I don't know enough about federal politics, whatever bills is called federally, where he puts a pot of money for transfers, and only those that want to uphold to national standards have access to that money.
We call that the coalitions of the willing. But yes, we are ready to work and support any action on this across party lines. It is absolutely a nonpartisan thing. 100%. I think it would be unconscionable for anyone to profit politically off of this issue. And certainly I couldn't live with myself given my personal experience with this issue. So I'm just going to thank you. And I know everyone has busy days, and we're going to probably be calling you lots more. So I never want to take up too much of your time. Thank you so much. And have a little siesta today, Doris. Okay?
Trust me, I will.
Okay. Bye-bye, everyone. Thank you so much.
Okay,
Bye.
thank you. Thank you, everyone. Bye.